everyone was like, she's going to be a doctor and she'll be a medical doctor. And I was on my way to do that. And I was just about to submit my applications to medical school. And in that semester, I took a course on social determinants of health. And I remember sitting in that class and being like, oh my gosh, like I want to be a doctor because I want to make a broader impact. And not that doctors don't make broader impacts, they do. But that one to one versus one to many piece was something that just kind of like stuck in my head. And I said, like, I want to make an impact on a global scale, like a one to many scale, on a population level scale. So that's when I pivoted to public health. And I think that was the very first time that I really did something for me in getting to know myself and who I am. Because prior to that, I just kind of was fulfilling my family's dreams and what they wanted of me.
Hey friends, welcome to Public Health Careers. I'm Omari Richards, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Angeza Mohammed. Angeza is founder and CEO of the Consulting Nest, where they're creating a marketplace for knowledge sharing, connecting consultants to vetted opportunities. She's also founder and CEO of Angeza Consulting and How Did You Learn to Do That Incorporated. Angeza helps public health consultants thrive without overwhelm and supports early stage public health professionals in navigating their careers. She has over 10 plus years of experience as a public health leader and speaker. She conferred a Bachelor's in Health Sciences from Simon Fraser University and a Master of Public Health in Social Policy at University of Victoria. In today's episode, you'll hear and learn more about Angeza's journey into public health, the Consulting Nest, and the new Transformational program for public health consultants, why Angeza feels learning about your ideal lifestyle and building your career around it is incredibly important, and much, much more. Be sure to subscribe if you have not yet and share this episode with someone who gets some value from it. Enjoy.
Hey, I'm Angeza. I'm a public health entrepreneur, and you are listening to Public Health Careers.
Angeza, welcome to the show.
Thank you for having me. I'm excited to be here.
Yeah, likewise. I'm excited to hear more about your journey and as well as all the businesses that you've built and especially the work that you're currently doing in those businesses.
Yeah, I'm excited to share and to share more with your audience and to answer some questions. Public health and public health careers is something that I'm super passionate about, and I want more people to learn about it. So I'm excited to share more.
I'm glad to have you on because I got questions to ask. And the first question is, how do you identify and tell us a little about your personal background?
So I identify as my pronouns are she and her. And my background, I'm actually from Afghanistan. I live in Canada now. And so that's my historical background and my familial background. I have a master's of public health in social policy. I have a bachelor's of health science in quantitative modeling. So they're actually both public health degrees. And they were both of them at the time that I took them were brand new. So I was in the second or third cohort of the programs. And it was just when public health was starting to really come to light. It was always, public health has always been around. It's been around for over 100 years. But I think it's been more formalized in the last 20 or 25 years. So yes, that's a little bit about my background and how I came to really get into public health.
Well, shout out to you for taking the chance on be the first class into both of those programs and taking a chance on public health. Look forward to hearing more about those experiences as we get to them in your journey. What was that transition like? I don't know what age you moved from Afghanistan to Canada, but what was that transition like for you and your family? And
Yeah. So I was just 18 months. I was still a baby. I actually don't have a lot of memory about the transition. But I did do actually in my undergraduate degree, there was a question around finding out how um, someone that's an immigrant, how they compare health systems, like from where they came from and what they have today in Canada. And I chose my grandparents. And actually through that project, I learned so much about our history that I didn't know. Like I knew we left Afghanistan and went to Pakistan and lived there for a year. And then my grandma's brother, who was in Ontario, he sponsored my entire family. And my grandparents have 6 kids, right? So it was, that was a huge sort of task to take, is to sponsor about 11 people all at once. Um, and in that project, I learned that what happened actually was the war was just starting to break out when we were in around 1989, 1990 with the Russian invasion. And my two uncles, my mom's two brothers, and two of our cousins, their cousins, were kind of on their way to school. And it's like one of these crazy stories. And every time I tell it, I'm like, I don't even know if I'm dreaming or this is for real. But they were actually kidnapped to become child soldiers. But the Taliban at the time. And they ended up somehow getting away overnight. And they ended up actually walking like through the mountains and then ended up in Pakistan after 5 days. And my grandparents, and the other set of grandparents, they just thought their kids were lost. Like it was kind of like something that was just happening, and they had kind of thought, okay, my kids have gone. They're gone to be soldiers. I'm never going to see them again. Um, and when they got to Pakistan, they ended up calling the grandparents, and we ended up, from what I understand, is they ended up paying a human smuggler, and then we just kind of left overnight with nothing. Just left everything behind, and that's how we got to Pakistan, and then obviously came to Canada a year later. And it's one of these like crazy stories, but I feel a lot of gratitude and for their sacrifice and for what they did, because I don't think I would have these opportunities that I do today had I stayed. I mean, it's still a beautiful country, and I'd love to go back pretty soon in the next couple of years, but um, it's just a different life that I don't think I would have been able to experience what I have today.
Wow, firstly, I feel like that could be a book in itself, or that story needs to be shared more widely. But that's awesome that they were able to be resilient, to escape the Taliban, to come and I guess rescue your family. In many ways, that's awesome. I appreciate you sharing. So pivoting a bit, wanted to ask you the question because you have a lot of expertise with working with and as a public health consultant. What's the most important thing public health consultants need to do to thrive without overwhelm?
Yeah, it's a really, really good question. I think public health consulting is just like any other entrepreneurial venture. You're building something for yourself. You're building yourself a business, and the business aspect of things is not something we're trained as public health professionals. It's something that we have to learn, and it can feel so overwhelming to figure out where you need to go, what you need to do, how to build your business. The number one thing I actually would tell people, and the most important thing I would tell people, is to get very clear on why are you becoming a public health consultant? Like, what is that purpose? So what is that difference between having a job as a public health employee and becoming your own boss and your own entrepreneurial, building your own entrepreneurial business? And getting very clear on that will help you essentially weed out the tasks that are not necessary, because you can get lost in the big shiny object syndrome where you feel like you have to show up at every conference, you have to be at every event, you have to do speaking engagements, you have to post content, you have to do this, you have to do that, because all of that is peripheral to the actual content that you want to create as a consultant when you get those opportunities. So getting very clear on why you want to become a consultant, and then very clear on which things you think will help you get closer to that, really helps you eliminate the overwhelm. And also just setting goals for yourself, like not trying to do everything all at once, but really being clear on what you're going to do in each corner, what your focus is on each corner. And just learning that it takes time. It's not something that's done overnight. You're not going to, build a successful business in 6 weeks or 6 months. Like, it's going to take some time, and just trusting the process and just staying consistent to the process, I think, is key.
And as a three-time founder, what kind of advice do you wish you had before you started your businesses?
I think what I just said, because I definitely, when I started, I always had an entrepreneurial spirit, and I always knew I wanted to do something a little different. Um, and and when I started I had a podcast, and it was called How Did You Learn to Do That? And I was interviewing people on how they learned to do whatever it is they were doing. And I just generally am curious about people. But through that, I started to actually do career coaching for early career professionals. And then now I work with public health consultants, newer public health consultants. And the biggest thing that the difference I've noticed in as I've, progressed in all the businesses I've built is being very intentional. I know we hear about this thing around working less and making more and having more impact. That was a concept that I didn't quite understand. I was like, you do have to put in a lot of hours. You do have to keep working to make the impact and whatnot. But that's actually what I've learned is not the case. You just have to be super intentional in what you want to do, what you want to build, but also around your lifestyle, right? We don't become entrepreneurs because we want to work 24/7. We become entrepreneurs because we want to make an impact. We want to build a lifestyle for ourselves that complements what it is that we want to do. And just making sure that you're able to keep those two things at the forefront and build according to that, and just being authentic to yourself and authentic to who you are. And the other piece that I would share is just learning your niche. I know niching is this thing we always talk about, and everyone's heard about it, but it's not something that we understand how to do very easily as new entrepreneurs. But I think once you learn your niche and you focus on that, it really makes a huge change.
Lots of great pieces of advice there that I feel like anyone can take and apply. But I think to your point of like just being intentional and being clear on like what are your goals and then taking steps towards those goals, because many times we do things that aren't really moving us towards those goals, but are taking up time in our day. And I also like the part of you highlighting like lifestyle business and like lifestyle design, I guess, because yeah, many of us think about entrepreneurship, want to shift into entrepreneurship, but not to get a job that's working 70 hours a week per se, but trying to figure out how do we create a business that can mold to whatever that lifestyle looks like for us. So, and then shifting, I guess, more to your expertise that you've done around career coaching for early career public health professionals, what's the most important thing that they must do right now?
This is actually something I'm super passionate about. The most important thing I think anyone should do, whether they're a public health professional, or entrepreneur, or in any industry, really is get to know who they are. Who are you? What drives you? What motivates you? I think is key because we go through, for example, high school, and we're just the only question we're ever asked is, "What do you want to do for a career? What do you want to study?" And then you get to university, and it's like, "What's your major?" Right? And we kind of check all these boxes, but we never we never ask ourselves like, who am I? What am I doing? What do I want to do? Not what does my parents want me to do? What do I think a cool job is? But really digging deep about who you are, what you want to do, is really key. I mean, for me personally, I knew from a young age, like it was kind of drilled into me a bit that I was going to become a doctor, and like everybody knew about it. Right? Everyone was like, she's going to be a doctor, and she'll be a medical doctor. And I was on my way to do that, and I was just about to submit my applications to medical school. And in that semester, I took a course on social determinants of health. And I remember sitting in that class and being like, oh my gosh, like I want to be a doctor because I want to make a broader impact. And not that doctors don't make broader impacts, they do. But that one-to-one versus one-to-many piece was something that just kind of like stuck in my head. And I said, like, I want to make an impact on a global scale, like a one-to-many scale, on a population level scale. So that's when I pivoted to public health. And I think that was the very first time that I really did something for me and getting to know myself and who I am. Because prior to that, I just kind of was fulfilling my family's dreams and what they wanted of me. Um, and I remember actually, I guess getting to know yourself in that experience teaches you a lot about who you are. And my personal experiences, I always knew that I wanted to be a mom, and the kind of mom I wanted to be. I wanted to be super involved. I wanted to be the chaperone. I wanted to be at the hot lunches. I wanted to just be a part of everything. I didn't want to miss a thing. And I met a doctor, and she told me, she was a radiologist, and she said to me, she kind of asked, I was asking about her career, but she kind of asked me point blank, if I wanted to be a parent. And I said, yes, I do. And she said, well, then you should triple think about becoming a physician. And she gave me her experience, and she just said, I have three kids, and I had them while I was in medical school early in my career, and the grandparents took care of the kids. And she said now they're 11, 12, and 14 at the time. And now she said I'm in a point in my career where I do get to spend more time with them. I've built a career, so I get more flexibility. But she said she's really struggling connecting with them because she missed out on so much of their life. And they actually prefer to be with the grandparents than they do with her. And she was saying that really was something heartbreaking for her, and she's navigating. And I remember thinking in that moment, I'm like, okay, that's not what I want. I don't ever want a career that takes time away from my family, regardless of what it was. And that's really why I got into consulting, and why I want to help other people do consulting as a potential option, because it's not just about spending time with your kids, but you may want to spend time with your parents, loved ones, your friends, or you may just want to have a different lifestyle, and a different pace of life. And I just want to help people do that easily through consulting. And public health consulting is a space that is not well understood. And so I want to make that an easier place for folks to enter.
You said a lot of great things there. And I think like centering on clarity, centering on that society and family and other influences in our life push us into quote unquote boxes or tell us that we have to be a certain thing, and then we kind of stick with it and we don't question it and we don't ask like, what do I actually want? How do I actually want to live my life? And I think back to like one of the most difficult decisions points in my life was having to sit down with my family and similar to you and say like, I don't want to go to medical school anymore. I want to like stay in this public health thing. Like that was one of the toughest decisions, but it was a decision for me in understanding the impact that you can make in public health. So yes, I think is so important, because then we end up in lives that are not the lives that we wanted, and then you despise people, you regret things, etc., etc. So definitely think about what is the long term vision, or what even might be helpful is like an anti vision, understanding that being a woman physician would be challenging to have that type of deep family bond that you would have wanted, and therefore it is not something that maybe is ideal for you at this point in your life. So I appreciate that a lot.
Yeah, exactly. It's that conversation with your family. It's a tough one because they just, I mean, I don't know how your family reacted, but my family looked at me blankly like, "What's public health?" Like, is that being a doctor or a nurse? And I was like, no, actually, it's much broader than that. And can you imagine the conversation I'm having with my family now about leaving a comfortable government job to become an entrepreneur?
Mm-hmm.
That's a whole other level of conversation, that I'm having with my family, and it's just it's the unique path sometimes that you have to take and just test and see how it goes, and really follow your passions and who you are.
Absolutely agree with that. So before we get more into your career journey, I would love to know, what does public health mean to you?
What does public health mean to me? That's an incredible question. And I don't think I've ever been asked that. So, to me, public health really means it's doing something to better humanity. And for those of us that are in public health, we know the implications of public health and the impact public health has across every single aspect of humanity. There's no industry, there's no sector, there's no person that really goes through life without interacting with public health in some way, shape, or form. Even when you're walking on the sidewalk, public health has an impact on the type of sidewalk you have, the trees that are planted in your neighborhood. It's all a part of the healthy built environment model. And and to me, public health really means exactly what the word is. It's the health of the public in a population. And the impact public health professionals have is broad. And really it's at the core of public health is at the core of what we see as a healthy society and a thriving economy. without public health, our economy would not thrive. We would not have a good population that can contribute to the economy, can contribute to society. So to me, public health is really important, and it to me, it's the core, it's the pillar of humanity, and without it, we wouldn't be able to thrive or survive. Everything would just kind of crumble.
Before we get back to the show, are you passionate about public health and looking to elevate your career, brand, and impact? Join the public health community today. Gain exclusive access to career-boosting events, connect with like-minded professionals, and stay ahead with the latest trends in public health. Plus, enjoy mentorship and career support to help you thrive. You'll even learn tips and tricks on how I grew my LinkedIn by 2,000 followers in the last 6 weeks. Sign up before the end of May to lock in your membership at the current rate before prices go up. Don't miss out on this opportunity to grow and connect. Join us at thephmillennial.com/join or in the link in the description and be part of our vibrant community dedicated to making a difference in public health. Let's build a stronger future together. Now back to the show. I wish we were able to make more of that connection between public health and the economy and economics, because yes, to your point, it is so helpful. Like if the workers couldn't go to work safely during the beginning of the pandemic, then we would have been in an economic catastrophe. So thinking about how has public health played a role in that and in everything else. So appreciate that perspective.
Yeah, no problem. And I just to your point about people going to work safely during the pandemic, that was such a tricky time because there was a level of behavior change that needed to happen at that time, and a lot of people, I mean, people in my family, people close to me, were like not understanding the restrictions, did not understand why we needed to shut down, did not understand why there was mask mandates and other kind of mandates. And I remember saying this to a couple people, and I said, these are the things that we need to do to protect the population. And yes, there are still, COVID is still running rampant amongst populations. Yes, there's still people being sick. Yes, our hospitals are full. But could you imagine how bad it would be if there was no mandates, if there was no restrictions? It would be catastrophic. There would be no space for anyone in any of the hospitals, any of the places that needed the space to help people survive and get through their infection. And that's the thing, is that's in that moment, I think through the pandemic is when people started realizing a little bit more of how much public health plays in protecting the economy, protecting people, protecting society. And having a place where, yeah, they were the heroes of the pandemic, and the villains at the same time. And that's just the double-edged sword that you have to play with public health. Is I'm here to protect you, and you might not like it, but it's not about you. It's about the many, the population, everyone, and doing something for the greater good of humanity.
Absolutely agree with that. And yeah, it's definitely love hate, because they are the people that have done the work to ensure that we are having those mandates, having restrictions, having different procedures in place. But then we also can deem the people that are taking away people's freedoms, not letting them go to places that they want to do, stopping them from doing what they want to do. So yes, you can never win, but I think the more that we're able to communicate what we do in public health and the important work of it, we will hopefully have a better narrative with the broader public.
Yeah, exactly. That's exactly how it is.
And you got your Bachelors of Science in Health Sciences at Simon Fraser University. Tell us about the thought process of going into undergrad, and did you start off as a health science major?
No, so I actually, after university, I wanted to be a bit of a rebel. My parents are a little bit more traditional. So they didn't allow me to kind of study abroad. And that's all I wanted to do, was study outside of home. I wanted to move somewhere. So the only schools I applied to out of high school were far from home. And I got into them, but I did not get to go because it was a non-starter. And so I took a year off of school at that point because I hadn't applied to other universities, and I just worked and sort of just tinkered in different hobbies and things I wanted to do. And when I went back to school after that year, I was in between two, and it's funny where I've ended up now because I was of two minds. I was thinking, okay, should I go and do business school or should I go and do medical school? And what I did for that year is I took courses in both. I took business courses and biologies and your chemistries and your physics and all of that. And it wasn't until that year ended that I realized I really wanted to go into healthcare. I really wanted to go to med school. So that's when I went to do the health science program at Fraser. And I did that program, and that was when I realized that this is really where I wanted to be. And it was within that program that I switched from med school to public health. And it was a little bit of a trial and error process, and just making sure that I was doing something that I felt really passionate about and really happy about.
Was there any one story or moment that kind of led to you switching from wanting to pursue medicine into wanting to pursue public health, health sciences?
Yeah, there was definitely several moments. So the one I mentioned earlier about my conversation with that physician and also taking that course. But there was a moment where I was a part of a medical fraternity, so it was everyone trying to go to med school. And there was a moment where now the seats for med school have expanded in this province, but at the time they were still limited. And I remember there was this rumor or this rumbling around people buying seats, like really wealthy families donating to the university in exchange for their son or daughter getting a medical school seat. And I remember at that time just thinking, I'm going to work so hard to go to med school, and I just can't compete with that. I can't compete with that. And the people that I knew that were doing so well in that medical fraternity, they were honestly doing everything they could. And I could see the impact and the toll it was taking on them. And they were so driven to go to med school, and it just kept failing year after year. And they kept going for it. They kept going for it. And it was all they wanted to do. It was like what they wanted to eat, sleep and breathe. And I didn't feel that way in my heart about med school. I knew that it was something that, yeah, it was nice. I would have liked to do it, but it wasn't my do or die choice. And when I found public health, I found a lot more impact in that, a lot more passion about it. And studying it and reading it and doing extra work in public health because I'm so passionate and interested in the topic and the area and just what you could do in public health. And the impacts that it was having was really sort of culmination of those things is what really got me to move into public health and make the choice not to go to med school.
Okay, well, I appreciate you sharing that. And I don't think more people listen to this podcast than in the US than are in Canada. We definitely have Canadian listeners, but I know that getting into medical school in Canada is actually harder than it is to get into medical school in the US. And getting into medical school in the US is also extremely hard. So I could imagine what those students had to deal with to try to get into those programs and just what that does to your psyche, to your body, to all the things. So understood why one of those reasons for switching. So that conversation with that physician was also during your time in undergrad?
It was, yeah.
Okay.
Yeah, it was right before I was submitting my applications to med school.
That's a good time, I guess, to hear that information.
Yeah.
And did you have any undergrad takeaways that you wanted to share with us?
Oh, undergrad takeaways. Yeah, if you are currently an undergrad and you're listening to this, studying and completing your program and your degree, yes, it's really important, but enjoy the process, enjoy being there, and enjoy people that you meet. Go out for coffee, go to the pub nights, go and get to know your people that you're studying with, have study groups, and just understand that doing university is a special moment. It's yes, it is about the grades and it is about your future and all of that. But in my personal experience, I've never had to show anyone my grades or my report card. So in hindsight, if I was not going to go to med school, I think I would have just enjoyed my time there a little more, and I would have still studied, but I would have studied in groups. I was just a high achiever, and I just wanted to really drill down and stay focused on studying. That I feel like I didn't get to enjoy the process of being in university as well. So if you are still in university, that's what I would recommend: is take it easy on yourself, study hard, but also don't forget to play hard as well, and just enjoy your time there, and just go to those fun events, and just take a breather, take it easy.
I totally agree with that. That I think that especially because we don't get those kind of experiences, moments in life often. So like definitely take the opportunity to enjoy all that it has to offer.
Exactly. Yeah, it's when else do you get to just study and not have to work and not have to have responsibilities? You literally just go to school and just try to study and enjoy your time there. I think it's such a special moment in time, and some of the friends you make in university will become lifelong friends, and they'll be with you through many other moments. And just really prioritizing and investing in those relationships is key.
You got your Masters of Public Health in Social Policy at University of Victoria. Tell us about that thought process of maybe like applying for graduate schools. Did you know right after knowing that you didn't want to go to medical school that you would pursue a master's, and how did you come to the point of like Masters of Public Health?
Yeah, so when I decided I was going to do public health, I it took me about 5 years to complete the bachelor's program because I took a year off. I took a year to test out the waters, and then those last 3 years, I just sort of rushed through the courses to complete my degree because for some reason in my head I thought I was behind. These are things that you think in university, and then you get out and you're like, well, not really. I could have enjoyed time a little more,
Mm-hmm.
but I remember just thinking like everything has to happen and it has to happen right away. So I finished my undergrad, and I applied for my master's right away. So I only had about the summer break, 2 or 3 months before I started my master's of public health. And because I did an undergrad and degree in public health, I just thought my next step is a master's of public health, which I loved the program. I loved being a part of it. But in hindsight, I actually wouldn't have done a master's of public health because my undergraduate degree was a master's of public health over 4 years. So the content was the same, um, but the the difference really is that in a master's of public health, you learn how to operate as a professional. You learn how to do things in a professional capacity that you don't in other degrees in the undergrad world. I would have actually done an MBA, a Master's of Business, or a Master's of Health Administration, just knowing where my career is taking me now. But I don't regret doing an MPH. I think it was incredible, and it was something that I did right after undergrad because I didn't want to take a break. I just wanted to kind of go for it and get it done.
And during your time in your master's program, you were coordinator for the community development and administration at Kids Help Phone, as well as a population and public health project coordinator at Provincial Health Services Authority. Can you tell us about those experiences?
Yeah, so my work with Kids Help Phone, so I got that job just before I ended my undergraduate degree, and children's mental health is an area that I was super passionate about. Is actually an area I specialized in my undergrad, and it was just the perfect alignment. And I loved my time at Kids Help Phone. It's a national organization here in Canada. It helps children and youth that are facing mental health challenges or really anything that they're going through. They get access to counselors 24/7, either by phone, and now they even have text messaging and online chat as well. So if you are struggling with anything, you can connect with a counselor, and it's your identity is protected. They don't let anyone know unless you're obviously at harm. And and it's just a safe way for people to connect with mental health professionals. And so in my role, it was really about advocating and sharing what Kids Help Phone does. Fundraising, going through fundraising events, going through other sort of events where we were sharing awareness and really trying to talk to kids. So I loved my time there. I thought it was amazing. And it's such a great organization. I still support them to this day. And at that time, I got the opportunity to join the population and public health team at the Provincial Health Authority here in BC. And just being in public health and knowing I was going into my master's, I knew it was what I needed to do. And so when I jumped ship, it was quite unique in the experience that I had, because my MPH was at the University of Victoria, which is in the capital city of Victoria, British Columbia. Our government is also in Victoria, British Columbia, so they have a lot of connection with the university. And then the company I was working for was the Provincial Health Authority, who worked closely with our government. And it's a bit of an operational arm to the policies that the government creates. So in school, I was studying reports or initiatives or projects or programs that were being developed that my colleagues were developing in the Provincial Health Authority. So it was actually really interesting being in that role, because, my colleague that was sitting next to me was putting out a healthy built environment report, for example. I was studying it and taking it apart in my project at school, and then reporting on it. So it was a bit of a unique trifecta where I could see the behind the scenes of what goes into developing these policies, these reports, recommendations, and programs, and then also have the ability to critically analyze them as well. Was really awesome. So for me, doing that role in population and public health while being in my master's of public health was incredible. And I had such an awesome director at the time who supported my education and allowed me to do any project I wanted within the organization, and really supported me in doing my practicum there. And for me, it was just the perfect trifecta that allowed me to see public health on many different angles, both from the theoretical to the application of it and the impact that it has across populations.
I always talk about the benefit of working, interning while you're doing your master's program, because then it makes the material that you're doing a lot more relatable. You got that on on 10 times that level of being able to work with the people of the work that you're learning in school, that you're talking about with people, which I think is awesome. And that provides just so much different layers of learning and understanding of the content, as well as dissecting and trying to think about, okay, how can we have done this differently, or on things like that. So that's an awesome experience that you were able to have.
Yeah, and that's a really good tip that you give, that interning while you're doing your studying is key. It is really important, because there's so much you learn on the job, and there's so much you learn inside of organizations, and just how public health it operates, the nuances of it. So being an intern while you're doing your schooling is really important, and it will give you a unique perspective.
And you reflected earlier, sharing that you, reflecting back, you would have done an MBA instead of an MPH, because you already had a lot of the content knowledge. You also shared earlier that in the MPH program, they don't teach us about business, about these kinds of aspects of consulting and things like that. Were there any other things that you thought the MPH program lacked for you, or maybe things that it gave you that you didn't expect?
I don't actually think it lacked anything. It provided everything it was supposed to provide. But what actually it's quite funny is the person that designed the program, the director of the schooling for public health at the University of Victoria, was the same person that designed my undergraduate degree 9 years prior. So he designed in it with a team of people. He was the lead designer for my undergraduate degree at SFU, and then went on to University of Victoria and designed their public health program. So I quite literally repeated my undergraduate degree in 2 years, and I obviously excelled because I repeated the courses. I had the content already. But I love that they brought the professional part to it. The professional part of how do you operate as a professional health, public health professional? How do you format reports? How do you create graphics that really help share and build health literacy across populations? If I could make a recommendation today to public health programs, it would be to have 1 or 2 courses or a bit of some sort of program around careers in public health. it's great to have the content, it's great to have the knowledge, but towards the end of the program, there needs to be a course or a program or some sort of initiative around what does it mean to have a public health degree and what kind of careers can you do. It's it's so hard coming out of university, and I was very fortunate that I already had a public health job, but I know tons of friends and colleagues that came out and were just like, what do I do with my public health degree? And often public health jobs, when you look at the for it in a title of a job description, it's not there. It's not always obvious that that's a public health role. There are a number of organizations that curate sort of jobs you can do. And if you look at all of them, you'll see public health is often not something that's mentioned in the job title. So I would recommend you, for people that are listening, to actually connect with people that already work in public health. Ask them what kind of job titles operate in a public health team, and just be mindful of that. Learn more about the role, the job, and just know that public health has such a large application. And yes, you can look for jobs in health authorities or states or governments or hospitals or insurance companies, but there are also public health jobs in so many different industries that we don't look at and we don't think about. And just kind of have to do a little bit of your own homework to figure out what those jobs are, where those jobs are, what they're called, so you can do an accurate job search. And that just comes from informational interviews with people. So that's what I would recommend to public health schools at this time, is to have a little bit more emphasis on what does it mean to have a public health career, because often we educate public health professionals, and unfortunately we don't support them on the other end of graduation and trying to find a job, and we lose them to other industries and other career aspirations. And we always need more people in public health.
I can agree with that more. And I've heard that sentiment a lot, because there is so much that you can do in public health, but it isn't called public health. And I know that there's a book, 101 plus careers in public health, by Beth Seltzer and Heather Krasner, that kind of highlights different public health careers. But to your point, there's just so many ways that you can utilize your public health degree and expertise to make an impact in the world, and many different companies and sectors that like the skill sets and the information that you do have as that kind of professional. So just really thinking broadly about how you can apply that, whether that is in government, healthcare, consulting, et cetera, et cetera.
Yeah, exactly. Yeah, and that's a great resource to have. And just don't be shy to reach out to people, even if you think that they are in a role that's intimidating to you. Just reach out. People love to talk about themselves, to be honest. They love to talk about their career. They don't get asked that very often, so just reach out.
Yes, I absolutely agree with that. And especially as a student, people love talking to students and giving them guidance and information. So utilize it as much as you can. Of course, you can do it as a professional as well, but a lot easier, I would say, for students.
Exactly. Yeah, exactly. People love talking to students.
And after you graduated with your MPH, you became a manager for integrated risk management at Provincial Health Services Authority. So did you just shift into that position from your MPH to afterwards?
No, that was such an interesting position. It has nothing to do with public health. At the time that I applied for it, I was like, I don't know what I'm doing, but there was I just have always sort of followed my gut instinct on different things. And I love trying out new things. I'm one of these people that every couple of years I get the itch to move on to something different in terms of my job. And it's because I just love being a learner. I love learning. If there was a career, honestly, if there was a job where I could just go to school and I got paid for it to just take courses, give feedback or something, I would do that job, because I just love learning. And so when I was sort of thinking about my next step after I was graduated from my MPH, I became a consultant. That's when I started my consulting career. And I just thought to myself that I want to try something a little different, just to see what else is out there. And this role came in risk management. And at the time, I had an executive director who had come from risk management to public health. And I had a conversation with her, and she said, it's actually, risk management is no different than public health. You do want to look at risk in a proactive way, and how can you prevent and promote? And those are two tenets in public health that we often have. How do you prevent and promote? And so when I went into that role, integrated risk management is a proactive framework where you want to look at what are all the risks that could potentially occur, and how can we set up mitigation strategies to prevent them from occurring, or trying to minimize the impact if it did occur. So that role was actually one of my favorite roles, and still is to this day, where I actually traveled across the province to various agencies, programs, services, and I had conversations with physicians, with medical leadership, with corporate leadership, just around what kept them up at night in terms of risks, and how can I help them create a reporting framework that reduce the type of risks that were keeping them up at night. And it was a rolling report, which means that it rolled from the managers, directors, all the way to our corporate and senior executive, and then the board. And it was a way to report on risks that removed the feeling that you need to be putting out fires every time, but gave you a fulsome preventative framework. And when it comes to public health, my public health training really helped me in building that program, because I knew what it meant to set up a program that prevented something happening to a population or to an individual, and creating something that allowed more positive impact. So when I say a public health program or a public health degree has broader implications than just the traditional public health career path, that's what I mean. We can take our knowledge and our expertise and apply it in so many different ways. And we have such a unique perspective and unique way of looking at things around health equity and bringing in different lenses and perspectives into an initiative, that you can be unique in your career aspirations and do something like I did in risk management, which traditionally may not look like a public health career or a public health degree, but it really did allow me to take all of my knowledge and expertise and apply it in a risk management program.
I appreciate you highlighting that and kind of like going full circle on, public health can be applied to so many different areas of work. It doesn't necessarily have to be public health work, which I think is important. Or public health work is in other types of work like risk management. So that's cool to hear.
Yeah, exactly. Yeah, it's very unique what we learn in public health, and it's a very unique perspective and mindset that we learn to have, where we're looking at how does this impact everyone, not just one set of people, but everyone, and how do we make sure that there's equity amongst that, and how does that look? And I don't know of another program or another industry that thinks the way public health professionals think. And I think that's what's really unique and special, and that's why it can be applied in so many different areas.
I love that. And after this role, you were a policy analyst for health equity and population health at Fraser Health Authority. Tell us about that transition and what you did.
Yeah, so that was when I wanted to kind of go back to my roots in public health. And also I was newly pregnant with my daughter at the time, and I knew I couldn't do the sort of the heavy traveling that I needed to do in that previous role in risk management. And going into that role was incredible. I worked very closely in a dyad model, which had a medical director, medical health officer, and medical director, and a clinical director in public health. And every dyad had a niche in an area that they focused on. And the one that I was working with, the two that I was working with closely, focused on communicable diseases and harm reduction. So I supported them in everything that they wanted to do for the population. So for example, some of the initiatives that I worked on was around sexual health and bloodborne infections. At the time, NPEP and PrEP, which is pre-exposure prophylaxis for exposed HIV patients and people in the population, had just been approved by our government and was rolling out. And so I helped create the algorithm for the physicians of how they would actually prescribe that, the risk factors that they would consider, the checklist of how they know if a patient is a right fit for that protocol with NPEP and PrEP, and really how it would actually be prescribed and where people would pick up that prescription, because it was a new initiative. And I loved that work. I knew the impact that it would have in combating HIV and in the long-term AIDS as well. And some of the other initiatives that I had in that was around peer engagement for the overdose crisis. So engaging people with lived and living experience in overdose work is really, really important, because you can't build a program and a response in the time of a crisis without talking to the people that are directly impacted by your response. And so we created a strategy that allowed us to understand how, as a government agency and a government authority, we can work with people that had lived or living experience, and how we can bring them into our initiatives, bring them into our programs to provide their perspective in a safe and dignified way. And that was some of the most meaningful work that I've actually been a part of, is being in a room with people that are in active substance use disorders or have come out of that in the last several years, and just hearing their knowledge and their perspective and that lived experience.
That's great to hear that Fraser Health Authority is doing that work to really get those voices, because many times we don't try to solicit the people with lived or living experience, as you say, into designing this work. And I've done a decent amount of work also with the in substance misuse communities, and just having a navigator or someone that is familiar with the community and how people are operating, I think is so important for having an actual impact in whatever work you're doing.
Yeah, exactly. It's really important that perspective is really taken seriously, and that's embedded in the work that we do.
And I believe you were promoted into clinical operations and project lead overdose response. Tell us about that transition and what you do.
Yeah, so when I was doing the policy work, it very much functions like a consultant. You get projects and then you do the work. And I was doing consulting on the side as well. I had my daughter, and then I went off for about 16 months. That's in Canada, we're pretty fortunate that we get quite a long maternity leave. So I took about 16 months off with her. And when the pandemic hit, I was, I know I say this and you could probably relate, and everyone listening here that's probably can relate. But when the pandemic hit, I just had this urge, like, I gotta be in this, because we learn about pandemics, we learn about this stuff, but it's once every 100 years or so. And I was honestly surprised that we were in the middle of a pandemic. My thought, I was thinking, like, I gotta go, I gotta be a part of this. I gotta take all this like theoretical knowledge we were kind of told of this rare one-off event that would happen, and experience it in real time in a health authority. And when I went back to work, the opportunity came to be in overdose full time. And as I was in my policy role, I was doing part-time harm reduction and overdose prevention, and part-time chemical disease prevention. And at the time, I decided that, I really want to go into overdose work, because in BC here, we had declared a public health emergency around the overdose crisis and toxic drug supply in 2016. And the impact that was happening since then had seen great growth in reducing the number of overdose events, and also pulling people out of their homes and their private spaces to go to overdose prevention sites and be supported and reduce the number of overdoses. So we actually saw less people die from 2016 to 2019 based on these impacts and these programs that were implemented. But when the pandemic hit, it actually sent us backwards significantly. And we ended up going backwards to a place that was worse than what it was in 2016. So when I went back to work in 2020 and I saw that stats and saw that data, I thought to myself, okay, I really want to go into overdose prevention and be a part of that team that really helps to figure out what we need to do in a quick manner during a pandemic to support people that unfortunately can't socialize. They can't go out to an overdose prevention site. Our overdose prevention sites had reduced in capacity by 50%, and people were starting to go back inside and were too scared to come back out. And unfortunately, that meant more people were dying alone. And being a part of that role is I just love overdose prevention work and overdose response, and I also just love supporting and advocating for a population that is often not taken and not valued because they have a condition that's a substance use disorder that's stigmatized in society, right? And similar to, like, if you look at COVID, the expedited response the world had to that crisis to save people's lives, and everything happened, and nobody questioned, why is this happening? I don't want to serve. I don't want to save their life. Nobody said that. That was not even a thought because everyone knew this is what we need to do. But when it comes to the pandemic of the overdose crisis and people dying from a toxic drug supply, we don't get the same response. People do question, and they don't say it directly, but indirectly, there is that thought of, I don't want to save their life. There is a them perspective to it. And it's, for me, that's why I'm really passionate about overdose, because I want to advocate for people that circumstances that are not choices, the reasons that they've started having a substance use disorder or a mental health condition, it's not a choice. It's something that's happened as a result of a sequence of events that they were not supported through from childhood. And I mentioned earlier, I was passionate about children's mental health. I do have a very strong belief that whoever we are and whatever our life becomes and what happens to us, whether it's through mental health challenges or substance disorders or really anything, it always traces back to our childhood. That there was something that we were not supported through, or our parents were not supported through, and it was generationally passed down to us. There's the reason. It always tracks right back down to our childhood. And if we support children and parents in protecting parental mental health, but also children's mental health, we can actually see the cost benefit of that later on in life, and how we can actually reduce things like substance use disorders and rates of mental illness across various organizations and populations as well.
The stigma on substance misuse community is really sad, and like to the point of, I don't know, it's hard for people to grasp harm reduction approaches and see the importance of building infrastructure to support people that have an issue. And to your point, there's a lot of othering or them, and in that it is harmful in many ways. But yes, there's a lot that needs to be done to ensure that substance misuse people with substance misuse issues have the supports and resources to thrive just like anyone else in society. And I feel like that is one of the things we have to do in public health, and one of the hardest things to do is changing the narrative around stigma, and in that changing how we approach and work with these populations of people.
Exactly. Yeah. And one thing that I will say is that it takes a minute to understand what harm reduction is, but it takes a lot of training, of conversations, of getting to know people with substance use disorders to understand that sometimes it's okay if somebody doesn't want treatment. It's okay if somebody doesn't want to stop using drugs. It's okay. But how can we still support them so that they're not dying? If using drugs is a way to cope with life, that's okay. But how can we support them not to die? How to not have infection? And if we think of it from a cost benefit ratio and a profitability perspective, harm reduction saves dollars. So harm reduction saves money, saves taxpayers to pay dollars. So if we just look at it on an economic perspective, if that's what we want to do, less a societal perspective or a humanity perspective, for every dollar that's in harm reduction, you get out $4 in benefits. So somebody told me I could put, I don't know, $1 into an investment, and then in a year I can get $4 out of it. It's a no-brainer, right? So it's just that stigma we have to work past, and it's getting worse. And the pandemic actually made it a lot worse. And I was actually seeing a study yesterday about in New York, they are putting out legislation around social media use and phone use for youth and children. And because they're doing that, where they are putting in blocks, I can't say it exactly, so you'll have to look at the article yourself, and I don't want to misspeak, but essentially what they've noticed is the impact that it's had on children's mental health and youth mental health, and the amount that it's costing the state to treat, that they now feel that they need to put out legislation about blocking and limiting exposure to children around social media. And that's harm reduction. It's a harm reduction perspective. That's a harm reduction approach, right? And we need to do things like that to protect populations and to save dollars at the end of the day, because unfortunately everything to our government and to policymakers is around taxpayer dollars and finances and budgets. And if we reframe public health in that perspective, we can actually, I think, sell and drive a little bit more change.
Yeah, as I was saying earlier, like linking public health to economics and like linking harm reduction to the benefit that it brings, linking investing into youth and their families into the benefit that it brings 10, 20 years down the line. Definitely appreciate those perspectives.
Yeah, no, it's incredible. It's something that really excites me, and I hope more people do it, and I hope more people actually specialize in this, whether you're doing an MPH or you're going to go on to do a PhD or whatever it is in your career. This is definitely a niche that would be interesting to consider.
You are the founder and CEO at How Did You Learn About That Incorporated and the Successful Candidate. You're also the founder and CEO for a couple other businesses that we'll talk about in a second. But tell us about this first one. How did you get started? What do you do?
So How Did You Learn to Do That was my podcast, and it's the question I always have in my head when I meet someone. Is literally the title of the podcast, is how did you learn to do that? And I feel like I've just in my life have asked that question all the time, like even for yourself. The question I always have in my head is like, how did you learn to do that? Like, how did you learn that you wanted to be in public health? How did you learn you wanted to do a podcast? Yes, and specialize in the areas you specialize in. Similar to the questions you're asking me, it's just this curiosity I always have around people. And so then that's why I started the podcast and wanted to ask people, how did you learn to do whatever it is you wanted to do? And it varied from people in careers to people in business and building businesses to people building a yoga practice and a meditation practice. I'm always curious, like, how did you learn to do that? How did you learn that you wanted to get up every day at 4:30 and meditate for an hour? And how can I learn from that? And what perspectives could I take from that? And it was always grounded in this concept of your purpose in life or your why, which is something that I really have at the core of everything that I do. And doing that, I started the Successful Candidate, which is my course for early career professionals. And that's founded in 4 modules, and it's really focused on getting to know who you are, getting to know what it is that you want to achieve in life, building that connection to you, almost like dating yourself, like investing in who you are, like you would a friend or someone that you love. And then going through this very technical side of how do you look for a job? How do you find out if a career is for you? How do you find people? How do you run information interviews? How do you apply? How do you connect with organizations after you apply or get rejected after an interview or something like that? That's really the course that I built for that population of people that are coming out of university and college and are just sort of figuring out what's next for them and what they wanted to do. So that's sort of those 2 that I started off in my entrepreneurial world out after building my public health practice. It's just trying to give back and help people figure out how to start a career.
What was your biggest takeaway or story or lesson that you've learned or stuck with you throughout those conversations?
The biggest lesson is separating who you are versus who you think you are based on the narrative someone else has given you. And I feel like that's a really hard thing to do. And I still do it to this day, honestly. And then sometimes I have to sit down and re-question myself when I'm saying something to my daughter, for example. I have to think through why do I believe this? The thing that I'm telling you. Why do I believe this? And I have to dig deep about, is this my belief? Is this a belief that was told to me that I need to believe? what's the reasoning behind it? And for example, growing up, there was always this thing where I was almost forced to say hello to relatives. And I know a lot of people deal with this where they're, as kids, you're forced to say, go say hi to Uncle John or go say hi to Auntie. And it's like, you have to stop what you're doing as a child to go say hello. And sometimes me growing up, I despised it. And if I didn't say hello, I was given the narrative that I'm a bad kid or like I don't have manners or whatnot. And so with my daughter, I made the choice that I was never going to force her to say hello to anyone, but I also have to deal with the scrutiny that comes with that from family telling me that I need to have her say hello to folks. So there was a period of time where I started feeling like, okay, I need to tell her to say hello to people, you know? And it's just separating. That's just a little life experience example, but it's really separating that for yourself is who are you? Who have you been told to be? And what do you actually want? And that is something you can do, whether it's in your personal life, as the example I gave, or in your career, or in your education, or in building a business, whatever it is. I think that's the number one thing that I've learned in all those stories that I've heard from people on the podcast and all the people that I've mentored and coached over the years.
I love that. Like getting clarity and reflective on like yourself, because as we were saying earlier, like there are so many perspectives that get pushed onto us. We really have to figure out like what is for us, what works for us, and digging deep into those. Because some of the hardest things to break are like the beliefs, and many of those beliefs we never question why we have them. And I think it's important to question why we have those beliefs and if they actually serve us and the life that we want to live. So I definitely appreciate
Right?
you raising that up. Yeah. And okay, so that was the first foray into entrepreneurship. You're also, I guess, principal consultant, founder, professional speaker, podcast host for Angeza Consulting. Tell us about starting that up.
Yeah, it's so funny. I just had this conversation with my friend that I was telling her I'm embracing the art of doing nothing. And then I hear you tell me about all the things that I do. And I'm like, oh, wow. And she looked at me and was like, are you sure about that? Are you capable? It's so funny. But I am very much a passionate person. And I have multiple things that I love to do. And yeah, so the consulting company, like I said, it started when I did my MPH. It was something that I just was really interested in. I wanted to kind of test out different projects, different initiatives, different things, and just kind of wanted to start my entrepreneurial world in that way. And just naturally through that and through the other avenues that I've been, and especially on LinkedIn and posting there, I've fallen into a career as a speaker and a coach. And so I do speak with different associations, organizations, in different conferences and panels as well, and just bringing that perspective that I have with them, and also just being here, and on this podcast as well. And that's really the journey of how I got into those aspects of my career and my journey as a public health professional.
And what sorts of consulting supports do you offer?
So I do a variety of consulting. So I definitely do risk management, as I mentioned, for organizations. I do public health project management or program management. I've done strategic change and change management and strategic planning, I should say, especially around when there's initiatives that have to do with leadership changes. And when leadership is doing a turnover, I have helped organizations understanding how to best support themselves through that transition. I have done a little bit of evaluation and more content expertise perspectives in providing an overdose perspective or a thought process. But a lot of what I do is really around programmatic changes, programmatic strategic planning, thinking through strategy and leadership coaching, leadership transitions, and risk management is definitely an area I'm super passionate about as well.
And you are also the founder and CEO at the Consulting Nest and the Transformational Program for Public Health Consultants. So tell us about the thought process of starting this business.
Yeah, so this is the culmination of everything that I do, and this is my honestly my third baby, and I'm so passionate about this, and this is what all my energy is going towards right now, is building the consulting nest and the transformative program. So what the consulting nest is it's a marketplace for public health professional consultants. So I want to connect consultants with organizations seeking this talent. The organization side, as I mentioned, is broad. So it's really anyone can connect with a public health consultant. And I want to highlight what public health consultants can do. And I also want to make it easier for people that want to provide their expertise, their knowledge, their experience as a consultant. And doing that through a marketplace. So if you think about an Airbnb model, and where you're connecting with people that own homes and you're someone that wants to rent a home, and that platform connects those two parties, that's exactly what I'm doing for public health consultants and organizations seeking public health consultants. So think of it as a job board, but for consulting projects. The consultants are vetted, they're seasoned, so that reduces liability. They do have to go through either the new program that I've developed or go through an assessment if they are an experienced consultant that has done this for a number of years. And I do support the public health consultants through mentorship, through coaching. There is a community aspect to it. They can support each other. Consultants can also subcontract and do joint proposal submissions on larger projects. The other thing that I'm really trying to move away from and support people to move away from through the consulting nest is move away from RFPs. So request for proposals is something that we still accept them through the marketplace, but I would eventually love to actually not have them at all, because it is a ton of work and it's a ton of free work. So it creates a lot of inequities and has a lot of discrimination truly embedded through it. Because if you are an individual person that works full time, but you want to pick up a part-time contract, you have the knowledge, the expertise, you probably don't have a large team of people to do a large, huge proposal. And also, there is the truth that organizations sometimes don't hire, they can't hire everyone submitting an RFP. They hire one person, but there's nothing to say they can't take your ideas and ask that person that they've hired to implement that perspective. And unfortunately, that is a way of stealing your ideas and not paying you. And that, again, is discrimination and inequity. And it limits people actually joining as public health consultants and sharing their expertise. So I want to create an equitable and fair playing field for people that want to be public health consultants through this marketplace, and supporting that and advocating for that across Canada, the US, and then eventually globally as well. And I beta tested this marketplace last year with a number of consultants, and the biggest feedback I got was there was a need for a program that took new consultants and really taught them the ropes, taught them how to set up as a consulting business, how to really learn about themselves, how to build a business, how to be a CEO of their business, how to do sales, marketing, content creation, personal branding for their company, learn how to operate as a consultant. So how do you submit proposals? How do you engage in projects? How do you, gracefully accept a rejection so that you leave the door open for a potential opportunity next time? How do you actually work on a contract and then close it so that, again, the door is always open for you on other initiatives. And really, at the end of the day, it's all grounded in how to build your business around the life that you want to lead as a person, and not getting caught up in the big shiny object syndrome, as I mentioned earlier, and getting very drilled down and focused on what you're doing and why you're doing what you're doing. And having someone in your corner to help you with learning all of that, but also on the business development side, because I do work closely with consultants to ask them who they want to work with, what ideal companies, organizations, people they want to connect with, and I help them make those connections through the consulting nest. And so it is a startup. It is something that's brand new. We're just enrolling our first cohort, and we'll be doing another one in October. So if anyone's interested, they can always reach out or check out our website or find me on LinkedIn under Angeza Mohammed, and you can learn more about it. And I'm happy to have any conversations with anyone that's interested. But that's my huge passion project that I'm building right now, and that's where all my energy is going. And I really feel passionate about helping people realize that they have so much to give to the public health community and to public health globally and internationally, and just there's a lot of understanding that they're worthy to create the career that they want to career for themselves, whether that's in a job or as a consultant or however it may be, but you are worthy, and just learning about that is key.
And all those resources will be linked on the show notes page. So check that out if you're interested in any of that or joining the waitlist for the upcoming cohort. This is really awesome. And I think I'm glad that you're taking the culmination of your work and your consulting experience and then like bringing about this idea, which I think can really support a lot of people. And to your point, create more equity for consultants in doing public health work. So that's awesome. Before I moved you on to the Furious Five, the last five questions of the show, I wanted to ask, what do you enjoy most about the consulting work that you get to do, maybe outside of the lifestyle design, the lifestyle that you get from it? Because that's one thing you did highlight before, but I just want to kind of ask, what is something else that you do enjoy about the work that you do?
What do I enjoy about the work that I do? Well, on a personal perspective, I enjoy that I'm an entrepreneur because I do get to curate my life. So I mentioned not going to med school because I wanted to be a certain type of mom. And I just want to preface to say, not everybody has to be an active mom, because I know some people love just being career driven moms, and there's no shame in that at all. If you can't volunteer, you don't want to volunteer, anything that, like, I just want to say that we need to support parents however they want to parent, and kind of remove shame around it. I personally love volunteering with my kids at my daughter's school and being with my son, who my son's only 15 months, so he's a little baby still. But I just love spending time with them without feeling like I need to work. And that's the lifestyle that I personally am so passionate about. And I want to curate that for myself, that I could always be there, right? And I never want my kids to feel like mom was busy working or mom wasn't around us and wasn't present. And that's why I built this business, where I have it really drilled down, where the limited time that I have to work on my business, it's on very specific things that I know are going to drive and push that needle, and not all the other things that I think I need to do. And for other for on a professional level, though, for me to be able to help other people see within themselves that they can make an impact and create a life for themselves that they are super passionate about, and you don't need to sacrifice who you are and the life that you want for a career. You need to we need to in North America, we have this model that we live to work, and when work is all done, then we can live. But we need to flip that around, because we're in a crisis right now, and I don't know if everyone else feels this, but we're in a societal crisis where people are just done with the rat race. They're just done working so hard. And I've noticed a huge shift in people switching to a slower pace of life, moving to more rural and remote areas, or moving away from city centers and stuff like that. And I honestly think it's because we need to support people more in understanding to live first and work second. And I know this is a little morbid, but I say this to a lot of people, that if you walked out the door tomorrow and you got run over and you died, your job is posted the next day. And your family will feel and grieve your death for many, many years, their entire lifetime, until they die. So that should put into perspective where your priority needs to be, what you need to prioritize yourself on. You need to prioritize your health, you need to prioritize your wellness, and then you need to prioritize your loved ones, the people you really want to spend time with. And when all that's, all the cups are full in those perspectives, then you can look at work. But this idea of working till before you get to live is something we need to move away from. So that's what I'm really passionate about. I'm really passionate about helping people learn about that, to learn how they can create that lifestyle through consulting as an avenue. There are other avenues, but my focus is on consulting.
Yeah, definitely appreciate that. And especially in public health, where we see people burning out and overstressed and experiencing PTSD and all these different types of things. It's really reframing how we do think about what work looks like and how we can work and how we want to show up in work. And to the broader point, like, we are more than the work that we do, and we should find ways in life to celebrate all the ways that we show up outside of work, which are also very, very important.
Exactly. Yeah, that's exactly it. We need to help each other as a population prevent burnout, because that's a public health initiative on its own.
Yes. And now moving on to the Furious Five, Angeza, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
My first advice is enjoy the process. Enjoy what you're doing. Just learn as much as you can. While you're a student, we mentioned earlier, go meet your professors. Go meet people that work in public health. If you're doing a project, do a project that requires you to connect with someone in public health, because it is one of the only times where you kind of have an excuse or a reason beyond you saying, I just want to learn about you, which sometimes some people feel awkward about saying, but just saying, like, I've got this project, and as part of this project, I want to do this. So can I interview you? Go out and get to know people. This is how you can build your network while you're in school. So when you as you go through school, you'll have people that are championing you, supporting you, encouraging you. And then when you graduate, you'll have a network you can rely upon to connect you to opportunities as they come.
Number 2, if you were talking to someone wanting to get in your position, what advice would you give them?
Which position?
You can speak from the CEO perspective and then the job
I
perspective.
would actually say, if you want to be a business owner or an entrepreneur, my biggest advice to you is to, I know I keep saying this, but to figure out what kind of life do you really want? Like, what is it that you want, the perspective? Because let me tell you, look up this term, entrepreneurial resilience. There is a book called Scale Your Everest, and essentially it's an entrepreneur who built 3 businesses, but also has scaled Everest to its peak. And he says that building a business is the hardest thing you can do, and I could echo that. It's really hard. There's times where you feel so lonely. There's a lot of unknowns. You're kind of learning on the fly. There's no program that teaches you how to do this. So if you want to become a CEO and you want to build your business, it is really rewarding, and there's amazing things that you can do once you do get into it, and just start. Don't complicate it. Just start doing something really small and then build slowly. You don't have to have a perfected business plan. You don't need to have a content strategy. You don't need to have an idea. Just start with whatever you have, and it'll come together.
Number 3, what's something you're working on improving in your life right now?
Oh, what am I improving? I need to prioritize my health a bit more. Like, I need to really prioritize exercising more, because it's on my list of my calendar every day. But if there's something else that has priority, it takes over, whereas I need to make it a non-negotiable. So for me personally, that's what I need to prioritize.
Number 4, professionally, do you recommend anything?
Ooh, professionally, do I recommend anything? I do. I recommend not to take things personally. That's what I recommend to everyone, whether it's your job, it's a career, it's someone you're talking to. Don't take things personally, and almost have a bit of a separation between who you are and what you're doing, and your job and your career. And my other advice actually is I don't talk to my friends about what I do, because I don't need to, I want my friends to be my friends for me personally in my life. I don't talk to them about my career, my job, things like that. Yes, if they ask, I do share, but it's not something I talk about all the time. But that's what I would say personally, is don't take things personally, and have people that don't know what you do, because it's nice to just be in a bit of a bubble with them.
Yeah, I appreciate that. Like, being in other identities outside of who you are as what you do in your work, which I think is important. That's
exactly.
Awesome. It's good perspective. And then last but not least, if there was one piece of advice you'd give to your younger self, what would that be?
Oh, I think one piece of advice I'd give to my younger self would be don't be afraid to be yourself. Don't be afraid to be authentic. Just be who you are, and it will all work out.
Love it. Love it. Well, Angeza, thank you so much for taking time and hopping on here and sharing about your story and all the successes that you have and the successes that will come in the future. It was really, really fun to chat with you today.
Yeah, thank you so much for having me. I was honored to be a part of this podcast, and I loved all the questions and the conversations we've had, so I really appreciate it.
Yeah, awesome to hear that. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like if you're watching it. Leave a 5-star review. That really helps the show get out to more people, and share it with a friend who would get some value from it as well. Thank you all so much. See you all next week. Peace.